Yeah. Assalamualaikum warahmatullahi wabarakatuh and a very good morning to everyone. First of all, let me thank everyone for participating in the CME session of the 2020 with the topic of Last Time of Happiness Months by Dr. Tan Yeung. And before we start, let me introduce him briefly. Dr. Tan Yeung joined the Institute for Health System Research in Malaysia in the year 2019. He took up his first role in IHSR as one of the field supervisors during the National Health and Mobility Survey 2019 and worked actively as a team member for the healthcare demand module. And prior to his roles at IHSR, Dr. Tan was a dental officer in Perak and has worked closely with toddlers, school children, adults, and antenatal mothers and special needs children. He was also involved in oral health promotion activities and quality initiative programs in the district and state levels. And Dr. Tan completed his Bachelor of Dental Surgery from Vinayaka Missions University, India in the 2012 with scholarship from the Public Service Department of Malaysia. And he was the gold medalist and was also awarded the Best Outgoing Student Award by the Fairfax Academy in the year 2012. And without further ado, I'd like to invite Dr. Tan to start the presentation.
Good morning, everyone. Okay. Today, we will talk about oral health at the various stages of our lives. Hence, today's topic, a lifetime of healthy smile. Before we begin, let us take a moment to ponder on the importance of our teeth and oral health. How is our teeth important, you may ask? All right, we have a beautiful, confident lady here. She looks stunning, isn't she? Now, what about this lady? She's the same lady as before, still confident, but does she look as stunning as the previous photo? Teeth does play a very important role in our lives. According to the National Health and Mobility Survey 2011, 2015, and 2019, there was an increase in population in Malaysia with reported dental problems, but a decrease in population who seek care from a dental practitioner and a decrease in population who utilize oral healthcare services, as depicted in this figure. The prevalence of oral healthcare utilization last year was only 23.7% compared to data from other OECD countries, which were 63%, so much higher than the utilization in Malaysia. The same study, 69.5% of the population in Malaysia did not perceive the need to seek services from a healthcare practitioner, stating the main reason as not being sick enough to necessitate treatment. So, what does this finding tell us? It says that public perception on oral health care needs is still low, and medication may bring more harm than good in the long run. Oral health problems, if not managed early, will necessitate more complicated, painful, and costly procedures in the future. The public needs to understand that oral health problem needs to be treated as soon as it is detected, and many a times, the initial stages of oral health problems such as dental caries is often asymptomatic. Hence, regular dental visit to the dentist is crucial. Oral health care is important in every stages of our lives, from pregnancy to our later years. Now, let us walk through some oral health topics at the different stages of our lives. Oral health is important even before we are born, the stage of pregnancy. Here are some myths surrounding pregnancy. Many think that the baby takes up calcium from the teeth, and losing teeth after pregnancy is normal. But these are all myths. It is not true. What changes during pregnancy? The placenta, which is formed from the baby, produces higher levels of estrogen and progesterone in the mother. So the changing hormone levels in pregnancy directly affects gum problems and indirectly causes tooth decay. So here in the first photo, you can see tooth decay in a pregnant lady. Whereas the second photo depicts gum problems in pregnant lady, which are usually red and looks like a swollen strawberry, often bleeding and sometimes has pain. This we call it pregnancy tremors. Here we can see the anatomy of the tooth. Our tooth consists of three layers. The outer enamel layer is the strongest layer of the tooth, whereas the second layer, the dentine, is more sensitive because it's closer to the pulp, which is the innermost layer, which holds the nerves and blood vessels of the tooth. Surrounding this tooth is the bone, which holds the tooth. First stage of gum disease progression, we have gingivitis. Gingiva meaning the gum, itis means inflammation. When there is food stuck on the tooth surface, this food becomes irritant, and this irritation increases during pregnancy because the action of the progesterone during pregnancy causes increased vascular permeability in the gums of the pregnant lady. As such, this irritation will cause inflammation of the gums and the gums become swollen. And when these gums become swollen, inflammation happens and bone loss occurs, which leads us to periodontitis and later on advanced periodontitis. When the bone loss occurs, the tooth will become shaky because there is no more support from the bone. The bone is like the cement or foundation of a building. Without this foundation, the pillars of the building will be shaky and it will collapse. So what are the potential consequences of gum problems during pregnancy? Mothers who have gum problems, especially attachment loss, which is the loss of bone, have a higher risk of giving birth to low birth weight babies. And periodontal disease are related to many systemic diseases, such as preterm birth, fetal growth restriction, low birth weight, preeclampsia, and gestational diabetes. Next, we have tooth decay progression. Tooth decay happens when food gets stuck on the teeth and the action of bacteria eats up this tooth and produces acid. This acid will corrode the outer layer of the tooth, which is the enamel. Even with metal surfaces, when you put acid on it, it will corrode the metal surfaces. Am I right? So what more if it is an enamel which is made of calcium? So when there's a decay on the tooth, it will progress if it's not being treated by a filling. So the decay will extend into the inner layer, which is the dentine, and then becomes more sensitive. And when it reaches the pulp, it will cause inflammation there. And the inflammation will lead to abscess after that. And you have toothache. So what are the factors which cause poor oral health in pregnancy? When you are pregnant, due to hormonal changes, you will have cravings, especially for carbohydrates. So you will take more carbohydrates and sugary food, which will get stuck onto your teeth. Other than that, you will have hormonal changes which cause you to have nausea and vomiting. Imagine the food in your stomach, which is sticky and acidic, coming out from your mouth and sticks on your teeth. If you don't gargle after your vomiting, you will have this teeth with all these sticky particles of food, which will corrode the teeth and cause dental caries and gum problems. So what result is gum problems. So when you have gum problems, there will be bleeding from the gums. And when most of these pregnant mothers, when they see bleeding from the gums, they will try to avoid brushing their teeth. And as a result, the gum problem becomes worse and become periodontitis. Coupled with this, there's also a dry mouth problem in pregnancy because the saliva decreases, the production of saliva decreases in pregnancy. And also mothers will tend to neglect their own oral health because they are busy dealing with the baby's health. This all leads to deterioration of oral health. So what to do then? We should have nutrition and dietary guidance. Eat a balanced diet. Food rich in vitamins A, C, D, calcium, and phosphorus is good for pregnancy. And you should eat in small portions, but in more frequency so that you can reduce nausea and vomiting. Avoid sugary food, especially between meals, and avoid dried fruit and toffees because dried fruit and toffees has high concentration of sugar as well. Nutrition is very important because it affects the health of the baby and also the mother. And vitamins A and D is good for animal formation. May I request the audience to mute your audio, please? Thank you. So some oral care recommendations during pregnancy is a combination of personal and professional treatment. After you vomit or you eat anything, make sure you gargle to reduce the acid content in your mouth and also to remove all the food particles which stuck in your teeth. After 30 minutes, try to brush your teeth if possible, because all the food particles that stuck on your teeth can actually cause dental decay and also problems. Always floss when you after you eat or at night at least once. Try to gargle with mouthwashes or warm salty water, because warm salty water relaxes gums and reduces gum sensitivity. Get professional treatment if you need them, and get a full mouth examination when you are pregnant. It's very important. So to the next stage of life, toddlers and children. The myth here is that baby does not need to take care of their oral hygiene because they have no teeth. And baby teeth is not important because it will be replaced anyway. So this is very bad. It's not true. Why need to take care of your baby's gum pads? Gum pads are actually the gums of the baby before the teeth even comes out. So we need to take care of a baby's gum pad because it reduces the bacterial growth inside the gum pads. How many of you would always kiss your children when they are born? Like allow your friends or your relatives to kiss your children in the mouth. Actually, it's a very bad practice because you are introducing bacteria into the gum pads of the baby. So if possible, try not to let anyone kiss the mouth of your baby when they are young. When you take care of a baby's gum pad, you actually promote good oral health. And how do you do this? You use a damp cloth or a silicone rubber on your finger and clean all around the gum pads and cheeks to remove any food remnants after feeding. Try to avoid using rough toothbrush or any material that can cause abrasion of the tissues. So here we have a photo of how we do it. You can take a gauze or a damp cloth, and after that you wrap it around your fingers and then clean the mouth of the baby. You should do this especially after feeding and at night. Now I would like to introduce to you a problem called early childhood caries. Early childhood caries is defined as the presence of one or more decayed, missing, or filled tooth surfaces due to caries in any primary baby tooth in a preschool age 12 below 6 years old. So here the two photos depicts early childhood caries. You will see the blackened areas of the tooth, especially at the upper part. So nursing bottle caries is a type of early childhood caries, and it occurs when you feed your children at night before they sleep and you don't clean their mouth after feeding. So they sleep with the milk bottle in their mouth, or sometimes away from the milk bottle, but they do not clean their teeth before they sleep. What happens is the milk or any solution that you give them before sleep contains sugar. Even the formula milk has lactose in it. This lactose is a kind of sugar that sticks into the tooth surface, especially on the upper top surface of the tooth at the back. The lower surfaces of the tooth are usually spared because your tongue is protecting on that surfaces. So what result is decay in the upper front teeth, which looks like a black short looking teeth. This may cause pain or swelling and affects the well-being of your child. So what is the importance of primary teeth? It helps a child to chew and speak. It holds space for the adult teeth and guide teeth during eruption. It aids in jaw and the face formation and influence the child's overall health. To prevent dental caries in children, try to avoid snacking of sugary products in between major meals. For example, between the breakfast, lunch, and dinner, when they are playing around or they are doing other activities, try not to give any snack that has sugar so that they will have no decay because these snacks which contain sugar will stick to the tooth surface for longer periods of time before they clean their teeth. If you give them these snacks during their breakfast, lunch, or dinner, at least the main meal, which is usually having fibrous product, can help to clean the snacks or the sugary products from the teeth. After taking snack products, if needed, try to make sure they brush their teeth at least 30 minutes following the meal. They should start healthy habits like gargling after every meal from young. And proper brushing technique is needed for at least 2 minutes. Many a times, these children, they just brush. They say they brush, but it's less than 2 minutes. Just probably 5 seconds, 10 seconds, and they say they have brushed their teeth. Improper brushing techniques is not useful to keep good oral health hygiene. Then the first dental visit and dental home. When does your child need to go and visit your dentist? The best time is when they reach the first age, that means their first birthday, or 6 months after the first tooth erupts, whichever comes first. It's normal and kind of expected if they cry, but try not to delay the visit just because you're worried of that. All right. And then there's a dental home concept, which is an ongoing relationship with a primary dental care provider and patient in which oral health care is delivered in a comprehensive, continuously accessible and family-centered manner. So try to make your dentist a dental home, whereby your children consider it as their second home to go to at various times of age. And also, before their first dental visit, it's important not to instill any fear of the dentist to the child, not to frighten them with the dentist when they do something wrong, because this will instill fear in the child. And with fear, they will be afraid of the dentist, and many problems in dental care cannot be addressed if they are not cooperative during their dental visits. During their dental visits, try to familiarize the child to the dental settings so that they are used to the dental setting. And during their dental visit, we will provide anticipatory guidance. So what are anticipatory guidance? Anticipatory guidance are guidance that dentist gives to the children and also to the parents to know what will happen to their dentition and how to prevent certain problems from happening. So in here, we will discuss about oral development, which is the dental and oral milestone, the eruption of the first tooth, the development of addiction, teething and tooth eruption time, and anatomical landmarks. And also, we will talk about diet and nutrition, about bottle-related dental caries, which I have already mentioned earlier, about weaning, that means when to stop from milk bottle feeding and all, and then the role of carbohydrates, role and identification of plaques, which is the food particles or biofilm that is stuck on your teeth. And then we will talk about fluoride adequacy, because fluoride is an important element which can help to strengthen the teeth, but excessive amount of fluoride can actually cause harm also. So we will talk about water evaluation and supplementation, breastfeeding, external source of fluoride, safety and toxicity, dentary fries, and topical agents. We also talk about habits like non-nutritive sucking habits like thumb sucking or finger biting, and also the role of pacifiers. I'm sorry, a participant shared something just now. All right, we continue with oral hygiene, about mouth cleaning, about Streptococcus mutans, which is the most prevalent and bacteria which causes dental caries in the mouth. Then we talk about tooth cleaning implementations and positioning and supervision. Then injury prevention, because kids will tend to play around and then they will fall. So about child abuse and neglect, car safety, child proofing, electric cord safety, emergency instructions. So here we have a diagram of teeth shedding and eruption. So in the baby teeth, it's very important to note that the baby teeth will shed at the age of 11 or 12 years old. So the teeth will be in the mouth for quite some time. Oral health. The permanent teeth is important to note that at the age of 6 years old, your first permanent teeth will come out in the anterior and the back part of the teeth. And most of the time, parents does not know that the last teeth which appears at the age of 6 or 7 years are actually adult teeth. So they will tend to neglect that teeth, and the adult teeth will eventually be decayed and will cause pain before they even have all their complete sets of adult teeth. These will cause the need for extraction of the teeth or root canal treatment in future. In case of your baby having teething problems, you can give them some pressure on the gums to help to relieve the pain, or you can keep it cool by giving some cold cloth or teething toy to relieve their pain. And then give them some hard food to chew so that they can relieve their pain, and dry any drool that comes out excessively during teething. That means the first tooth erupting. The next thing is injury and trauma. And I will only discuss about avulsion of the tooth because this is important. Avulsion of the tooth means the tooth is completely out of the socket of the mouth when they fall or they hit on something. So how do you manage an avulsed tooth? You should always hold the tooth at the crown area and not to hold at the root areas of the tooth. And then you can clean it slightly under the running water and try to insert it back to the socket of the child if possible. If not possible, put it at the cheek of the child, or you can put it into a milk or a warm salt solution or Hank's balance solution, or even in coconut water. And then bring it, the tooth as well as your child to the dentist immediately. They will be able to put it back and save your tooth. Next, we go to oral habits. The commonly occurred oral habits in childs are thumb sucking, lip biting, mouth breathing, and tongue thrusting. There's also the pacifier habits, which is the chut-chut that you put into the patient's mouth to try to convince them not to cry or something. That is actually very bad. And then there's also self-injurious habits, nail biting, cheek biting, postural habit, bobby pin opening. And these have major consequences on the development of the jaw of the baby. It causes malocclusion and change in the facial appearance. It affects the normal growth of the jaw and may cause them to lose aesthetics of their face and may even cause occlusion problems. So how do you curb it? There are interventions at home and interventions by the professionals. For example, thumb sucking. You can actually curb it at home by putting a sock on the hand in which they usually use to suck their thumb, or you can give them gloves, or you can even use band-aids, like plaster, to plaster the place where they put their thumb or their fingers into their mouth. This will cause them to feel irritated when they try to put their thumb into their mouth. If that doesn't help, then the dentist will make a professional appliance consisting like the photo below here, which will prevent them from putting their tongue or their thumb onto the palate. Some other management of oral health problems in children are fillings, oral prophylaxis, pulpectomy, apexogenesis, apexification, extraction followed by space maintainer, serial extraction, and myofunctional appliances. So if you have any child problem, bring them to a dentist and they will have a solution for your child. Next, we go to adults. Common problems seen in the adults are plaque and calculus, which we call TATA as depicted in the diagram A. And then due to this plaque and calculus, when it becomes worse, it becomes periodontal disease. And then there's also the dental caries, which is the diagram B, C, D, and E. And then tooth wear due to attrition, abrasion, erosion, and effraction, also known as regressive changes of teeth, trauma from occlusion, and cracked tooth syndrome. For oral hygiene, Try to choose and use soft bristle toothbrush, use a fluoridated toothpaste, and use just a pea-sized amount of toothpaste for adults. Brush at least twice a day in the morning and night, and use dental floss at least once daily before sleep. Why do we need to use a dental floss? It's because when we brush only, the food that gets stuck between the teeth surfaces, we can actually not be able to clean it away. When you use a dental floss, we can get in between these tooth surfaces and clean up any food that is stuck there and prevent tooth decay and gum problems. And then we go to mouth cancer. Risk factors of mouth cancer includes consumption of tobacco, excessive consumption of alcohol, chewing betel nut with or without tobacco, which is childrei, human papillomavirus, long-term oral cavity injury, people with history of cancer, exposure to harsh sun rays, unhealthy diet, weak immune system, and family history of oral cancer. So oral cancer usually starts in the mouth as a small ulcer or a white lesion, which is non-healing for at least 2 weeks, 2 to 3 weeks. So it's important for us to do self-examination to identify any signs of white lesion or ulcer or any bulging in 2 weeks' time. So there are 8 steps in oral cancer screening, as depicted in the right photos here. First, you have to lift up your upper lip to check your gingiva and your mucosa, your gums and your mucosa. Then next, you look at your lips and also your cheeks, your buccal mucosa, and the back of your gums. Then you lift down your lower lips to check your mucosa, the vestibule, and also the anterior gums. And then you check your upper hard palate and your tonsillar area, which is near to your Adam's apple, and then your ventral surface of your tongue, which is the lower part or the floor of the mouth. Some types of treatment available for common dental problems in adults are like filling, scaling, root canal treatment, prosthesis, implants, fiber reinforced bridge, adult orthodontics, and orthodontic surgery. So here in the left picture, you can see dental calculus, which is the thing that causes gum problems. And this dental calculus, if you don't remove it, will actually cause bone loss, which will make your teeth shaky and mobile next time, which will necessitate extraction. How does this calculus form? When food gets stuck in between your teeth, the minerals in your saliva gets deposited on these food particles and they become a hard structure, which is like a stone like that, and it's called calculus. This calculus actually harbors bacteria and germs. It's like a place for breeding of bacteria and germs. So these germs will eat up the food particles that are in the calculus, and then it produces their waste products, which is acidic, which can corrode the teeth. And also during this procedure, there will be inflammation of the teeth and bleeding of the gums because our body sense that there is a germ there that they need to fight. So there are more blood vessels production there, neovascularization, in which are easily broken and bleed. These blood vessels are like roads which brings our immune system to the area with the infection to fight the disease. But because they have a fortress there, which is the calculus, these germs will not be able to be eliminated. Hence, the inflammation becomes worse and worse. So how do you remove this calculus? By just brushing your teeth, this calculus, which is hard in structure, cannot be removed. You need scaling. Scaling is something that you do when you go to the dentist and they use special equipment to clean up all this tartar and calculus. So after scaling, you will see the second photo down there, which looks so much cleaner, right? Compared to the first picture. On the right, we have a procedure called cavity there, which is a whole filling material, and it will look just like a normal teeth. with the advances in dentistry, nowadays, we seldom use the amalgam filling, which is black in color anymore. We use tooth color restoration, which will restore your teeth to its original color and function. If the decay becomes worse, the decay will go and reach the dentine and the pulp of your tooth, and this infection will travel inside the roots of your tooth. The germs will enter and go down to the roots of the tooth and form abscess there, pus, nanah. So when you bite on the tooth, you feel pain because of the pressure. When this happens, you cannot just fill up your tooth like normal, because when you fill up your tooth like normal, there will be pressure built up inside due to the inflammation, which will impinge on the nerve vessels inside of the root canal and cause severe pain and swelling. So what to do? When you have this problem, you need to do a root canal treatment if you want to save your tooth, or else you might need to extract the tooth away. So why do you do a root canal treatment instead of extracting the tooth? Your teeth if it's still good, the structure is still okay, you can actually save the tooth so that the tooth can be used again. If you extract the tooth, you need to replace the tooth again with other means which will cost you more. So in this root canal treatment, we will use special instruments called endodontic files, which will remove all the blood vessels and the nerves inside the root canal until it is clean of germs and also any tooth structure. So consider the tooth is dead already. But the tooth is still there, but after filling, you can still use it to eat. After root canal treatment, usually we will advise you to have a crown on it to protect the tooth from fracture, because after root canal treatment, the tooth will usually be more brittle. Why can't you just eat medication and reduce the pain or the swelling when you have this decay until the root canals, which causes abscess? Because the antibiotics that you eat are too large in size that it cannot go into the root canal orifice, which is underneath the teeth, which is very small. So it can only clean up the germs which are around the tooth root. The germs that are inside the tooth cannot be removed. Hence, we have to remove it from outside. We have to open up the upper cavity of the tooth and actually clean it from above. And then we put medication inside, which will kill up the remaining germs inside. At the same time, we give you antibiotics to clear up any germs that are underneath the tooth. So there is a bidirectional relationship between oral health and diabetes. Okay, diabetes increases the likelihood of contracting periodontal disease, while periodontal disease exacerbates hyperglycemia. Management of diabetes in periodontal patients helps to improve periodontal condition, while management of periodontal disease helps to prevent morbidity and mortality associated with diabetes. 6 monthly oral health care is recommended for diabetes patients and more frequent if they have periodontal disease. The American Diabetes Association recommends oral health examination during a patient's initial health checkup. So why is it important to prevent instead of treat interventions? So when you have toothache, it will cause you pain, and with pain there will be more complications. When there is worse kind of oral health problems and you seek a dentist, the cost for treatment will be more because the procedure will be more complicated and the material used will be more expensive. At the diagram here, you can see the death spiral of the tooth. Here, the first tooth, you see a small tiny pack there, which is a small dental caries. If you do not treat this with a filling or what, the decay will become bigger, and with that, if you do not treat it with a filling, parts of the teeth will actually fracture, it will become even bigger. Then this decay might even reach to the pulp, and when the pulp is involved, you will have pain and swelling, which will necessitate a root canal treatment. And after the root canal treatment, if it fails, you might need a root resection or apicotectomy and a crown. If this fails also, you might need to extract your teeth, followed by a prosthesis or implant. From the first to the last treatment option, the price will range from a simple filling which in the government will cost you 2 ringgit, or in a private clinic around 60 or 80 ringgit, to an implant which will cost you 8,000 ringgit for a tooth. So it's your choice to think whether to prevent it with only 80 ringgit or to actually do an implant which will cost you 8,000 to 10,000 ringgit for one. So why regular dental visit is important? Regular oral health care utilization helps to maintain optimal oral health, aids in the early detection of oral health problems, and early management of oral health problems reduces complications, reduces pain, and reduces cost of treatment. So the take-home message here is, neglecting oral health during pregnancy causes tooth decay, tooth loss, premature birth, low birth weight infant, and pre-eclampsia. Good oral hygiene and dietary habits are crucial for development of toddlers and children. Take necessary precautions to prevent dental problems that may be irreversible. Tooth loss is not a normal part of the aging process, it is preventable. A compromised oral health reduces quality of life and affects nutrition intake for general well-being. Procrastination will lead to higher cost, pain, and complication. Therefore, prevention is better than cure. The Ministry of Health Malaysia advocates visiting the dentist at least once a year. So, do you think that dentistry ends once you reach your older age? If that is the case, if you are not a criminal or you are not in a criminal case. If you are a criminal or involved in a criminal case, dentistry applies even when you are dead. So the branch of dentistry which deals with dead people are called forensic odontology. So that comes to the end of our session today. And if there's any question, you may post it here. Thank you.
Okay, thank you once again, Dr. Tan Yuro, for your presentation. So we open the floor for any questions. So we just now. So we still have another 5 minutes to go. So if the participants have the questions, you are welcome to ask Dr. Tan Yuro about the topic today.
Check whether the questions are check.
So we have the question.
Is there any question? You can ask me any question. Question. Okay, to address the question on reversal of regression of tooth, I assume that you say whether we can reverse if there's bone loss after, if you don't take care of your teeth, there's bone loss, can we reverse that? The answer is no. Because once the bone is lost, it cannot be recovered, it cannot grow back. Because the bone loss is usually horizontal. So there will be no blood vessels which is there, which can actually help to regenerate the bone. Yeah. How to prevent calculus? You can prevent calculus by actually keeping good oral hygiene. As long as there's no food stuck on your teeth, the possibility of having a calculus is quite low. So how do you do the good oral hygiene habit? Is by brushing your teeth. First of all, gargle after every meal. And if possible, try to brush your teeth 30 minutes after every meal. And brushing is not enough. You need to do you have to use a dental floss to remove any food particles that are in between the teeth. These food particles that are in between the teeth can actually cause tooth decay as well as calculus. Other than that, when you have calculus, you go to a dentist, you get a scaling done. So scaling will actually remove all the calculus. So you have to, it is best to go every 6 months to a dentist to get a checkup. If during that 6 months period, there's no calculus or no problems with your teeth, at least you have peace of mind. And you go back another 6 months, if there's calculus, that means in a 1 year time, then you can clean it that time. Yeah, that's for calculus. But the Ministry of Health actually advocates once a year, because even if it's once a year, there's a very low utilization of oral health services, hence a year. How receptive is root canal treatment in government clinic for both adult and children? Well, in government clinic, root canal treatment is one of the treatment provided, no doubt, but it will depend on the clinic and the state you are in. It depends on the management also. But usually, if the canal treatment is needed and they put you on appointment, then they will do it. If it's a case that is too complicated or difficult to do, they will refer you to a specialist called an endodontist or restorative specialist, which will be able to treat the problem of a teeth better. Right, let's see what other questions that is there. Dental floss before or after brushing? Well, dental floss before or after brushing is a very controversial thing, because some says it's better to do it before and some says it's better to do it after brushing. But personally for me, I would say do it before you're brushing, because my rationale is that if you do it before brushing, all those teeth that is present in between your teeth can be removed first. Then when you brush, you usually use your toothpaste, right? And the toothpaste has fluoride inside, which can help to strengthen the teeth. So when there is no food particles in between your teeth, this fluoride, which is in the fluoride toothpaste, can help go in between the teeth and help to strengthen that part of the teeth as well. If you do it after toothbrushing, if there is a lot of food stuck in between your teeth and you don't remove it first, then the benefits from the fluoride in toothpaste will not be able to reach the in between the tooth where the food particles are. Okay, our next question is, what caused the development of tooth in newborn? Is it because of excessive calcium intake by the mother? No, it is not because of excessive calcium intake by the mother. Sometimes newborn are born with teeth. We call it neonatal teeth. It is due to the gum pads developing too fast in the cavity, so they are born with the teeth. Actually, if they are born with the teeth and it doesn't cause problem, it's not a problem. It is only a problem if it causes difficulty in feeding, or it causes abrasion of trauma to the gum pads of the opposite arch. What causes the development of all right. Is there any more questions that you would like to ask me? It can be on any topic about dentistry. I'll be able to answer you if I know about it. When should children change to adult? I would assume that you say this change the toothbrush or the toothpaste from child to adult. Am I right? If it's about that, then yeah, I will have to say that the toothpaste for adults should not be used for children, because adult toothpaste contains very high levels of fluoride, about 1,000 to 1,500 ppm parts per million of fluoride, compared to a children's toothpaste, which is usually about 500 ppm only. So a children's toothpaste should be used for children, and adult toothpaste for adults. When you use adult toothpaste on the children, it will cause a problem called fluorosis when the new adult teeth appears. Fluorosis is a condition whereby the teeth becomes yellowish with specks of whitish area, yellowish area, which is easily corroded or easily broken down, which means the tooth structure is brittle. So when should children change to adult toothpaste? When all the adult teeth is formed, then you change it to adult toothpaste. And then always choose a toothbrush which is a toothbrush size which is appropriate for the child's age and the child's oral cavity. If it's the children, get a smaller toothbrush, and then if it's adult, you can use a bigger one, because if you use a bigger toothbrush on a child's teeth, the toothbrush might not be able to access the back parts of the teeth, so they might miss that areas. And if you have problem with your children brushing their teeth, try to encourage them by putting on some YouTube videos of cartoons or children's brushing their teeth, or you can participate with them, brush with them, and ensure that they brush all surface of their tooth at least 2 minutes and twice a day. Okay, what causes bruxism and how to prevent it? What is the treatment? Okay, bruxism is a condition where you grind your teeth. And usually what happens is we call nocturnal bruxism. You bite or grind your teeth when you sleep. Bruxism can be caused by many problems. And one of it is stress, and some is just genetics. So when you are having bruxism, one thing is you can try to do stress relief therapy, or you go to a dentist and get a mouth guard. A mouth guard will help to prevent the tooth from grinding against each other, which can cause attrition. And other than that, it can help to relax your jaw also, because when you grind on your teeth, your jaws at the temporomandibular joint gets the stress and get affected. So in the long run, you will have jaw pain. The most effective whitening of teeth. Okay. The most effective and fastest way to whiten your teeth is to go to a dentist and get a bleaching treatment. A bleaching treatment usually uses a chemical called carbamide peroxide or hydrogen peroxide. And this chemical will help to produce radicals which actually whitens your teeth from inside. It actually converts those stains in your teeth into, remove all the stains inside your teeth and makes it whiter. So the professional procedure uses very high concentration of that chemical, which can cause whitening of your teeth in just around 1 hour or maybe 30 minutes to 1 hour. So that has to be done in the dental clinic, because it is a very high concentration chemical, which if you use at home can actually cause burning of your gums. And if not done properly, it can cause damage to your teeth also. And after whitening, usually you will have sensitivity of the teeth for at least 3 days to a week. But the sensitivity will go off after a while. And after whitening, it's important for you to keep the teeth clean and try to avoid any food or drinks that is staining in nature. That means like coffee or carbonated beverages with color. Yeah, try to avoid that. If you need to take coffee or anything like that, try to gargle after that. And after 30 minutes, just brush your teeth. If you have no access to any washroom, you can just take your normal drinking water and gargle in your mouth and just swallow the water, because it is your oral cavity, it's your saliva, the food that you eat, you swallow it as well. So it's actually very clean. You can just do that. Is soft bristle toothbrush better? Of course, soft bristle toothbrush is important, because when we brush our teeth, we just want to remove any soft food particles that are around our teeth, on the surface of our teeth. We don't want to abrade our teeth. When you use a hard bristle toothbrush, it will actually cause damage to our teeth, especially when we brush too vigorously. Because when you brush too vigorously, the pressure and the hardness of the bristle of the tooth will cause cavity formation on your teeth, which is usually horizontal like. And then the enamel layer, which is the hardest layer of the tooth, gets abraded. And when it reaches the dentine, which is the second layer of the tooth, your teeth become sensitive. So when you do that often, when you drink cold water or acidic drinks like lemonade, you will feel the very bad sensitivity there. So when you have mild sensitivity like that, what you can do is you use sensitive toothpaste. Sensitive toothpaste like Sensodyne or Colgate Sensitive Pro has a kind of salt inside, a potassium salt, which can help to close up all the small tubules around your tooth connected to your nerves of your teeth called dentinal tubules, and then it can help to relieve the sensitivity. If that doesn't help, you might need to see a dentist to get a filling done. The harder version of brush bristle is actually meant for brushing of dentures. Yeah, sometimes you need to brush your dentures, right? No gigi palsu, so you use a hard bristle toothbrush. Is it sufficient to use toothpaste with xylitol or with fluoride for children? I would, for children, without fluoride, it is okay as long as they brush properly. I mean, like if they brush like 2 minutes and properly on all the surface and really remove all the food particles, then dental decay is less likely. But if the children doesn't brush their teeth properly, it is better to use a toothpaste with low levels of fluoride, because this fluoride helps to strengthen the teeth by converting what we call calcium hydroxyapatite crystals in your teeth into fluoroapatite crystals, which are stronger and more acid resistant. So even if there are a little bit of food stuck on the teeth and it becomes decayed, the acid will not be able to penetrate the tooth so easily. Can we use xylitol gum after meal? By all means, yes, because a sugarless gum or sugar-free gum can actually help you to remove all the some of the remnants of your food particles, and also it stimulates saliva production. So saliva helps to actually cleanse your mouth also. So a gum after meal, provided it's sugar-free, is very good. Frequent teeth flossing will not cause teeth gapping in the long run. Actually, if you do not floss or you do not do scaling, then it will cause tooth gap in your teeth. And tooth gapping happens because of the loss of bone. It's not because of the action of you doing the flossing. As I said earlier, if there's food stuck in between your teeth and you do not floss to clean up the food particles, or you do not go for scaling with the dentist, this food will get broken up by the bacteria and cause inflammation over there. So with inflammation, there will be cells in our body produced, mainly osteoclasts. And osteoclasts are the cells which actually breaks down bone. So they will be there, and then they will start to eat up the bone there. So whenever there's inflammation, there will be inflammation, right? I mean, there's a bacterial infection, there will be inflammation. So whenever there's inflammation, there will tend to be chemical mediators there which can bring up all our defense system, which will cause some damage around the area with infection. So one of the damage is the breakdown of bone there, and with the loss of bone, our gums, which actually attach to the bone, will, along with it, recede. It gets lower in height. So when it becomes low in height, there is space in between there, which is the gaps in between the teeth that you see. Receding gums because of brushing too hard. Brushing too hard is not good for the gums and also to your teeth. That's why proper brushing technique is good, is important. If you brush too hard, it will cause, like just now I say, attrition, and it also can cause damage, or it can cause irritation to your gums. Whenever there's a damage or irritation to gums, there needs to be healing there, right? So when there's healing there, there's inflammation, and it can also cause loss of bone or something like that. But it's not as bad as not flossing your teeth and leaving food particles there, producing calculus or plaques, and actually reduces the bone underneath. As I said earlier on in the first question, if you have loss of bone, then it is irreversible. You cannot build up the bone, even with bone grafting, because there's no blood vessels around the place where you put the bone grafting. The bone grafting will usually necrose out and die. So there will not be new bone formation there. Yeah. So any more question? If no, we will end the session today. Hope the session is beneficial to all. Thank you.
Thank you everyone for the questions, and thank you once again, Dr. Tan, for the presentation on the topic, the lifetime of healthy smiles. And with that, we close our CME today, and hopefully we'll see you for next month. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh, dan selamat pagi. Thank you.
Stop record.